Hello, my name is Dr. Brian Raid, and I'm a naturopathic doctor. And this is a video about a response to a question that someone had posted in response to, or with respect to one of the videos that I'd recently put up about mandatory diets for treating yeast overgrowth issues. So the question was around how long does it take to resolve a yeast overgrowth issue / yeast overgrowth syndrome. The comment was something to the effect of, I've heard it can take 3 weeks. I've heard it could take several years. How long does it take? And so the answer to that question, in my experience, is a good old "it depends." That's kind of the stock answer to, I suppose, any question about anything related to anything health-wise or on a medical topic. But the less stock answer, the less cheeky answer is that it really does depend. But the range certainly can be as short as a few weeks. That is certainly happens, and it really depends on the nature of the symptoms. If it's a chronic yeast-related issue, say, creating like a vaginal candidiasis, that might respond pretty quickly. If it's a systemic, I've got tons of digestive issues, joint issues, sinus issues, etc., that are related to yeast, that might take quite a bit longer. As a general rule, it would be pretty rare for there to be a systemic yeast-related issue that would take longer than 6 months to be, at least 80+% resolved. So that would be kind of like a typical upper limit of how long it might take. But it really depends. Like, there's so many variables. If a person had biofilm-related issues, then that could significantly prolong the length of time it would take to get rid of the yeast. If the patient has a yeast hypersensitivity in addition to a yeast overgrowth, that also complicates matters. Yeast hypersensitivity is something that would relate to things like low-dose immunotherapy, which I've done some videos on, and if anyone listening wants to hear about low-dose immunotherapy or yeast hypersensitivity as it can relate to yeast syndromes, I'm happy to talk about that specifically. But that can definitely complicate things, because in that case, it's not just a yeast overgrowth. Your body's actually hypersensitive to the yeast, and so it's more like killing the yeast and allergy desensitization to yeast at the same time, which makes it more complicated. And then, of course, it depends on the vitality of the patient. So if a person is that their system has been beaten down by chronic health issues for some time, then it might take longer for us to build up their anti-yeast, say, herbal regimen. They might not be able to tolerate things very easily, so they're building up really slowly. It can take sometimes weeks or months just to get onto a full therapeutic dose of treatment. And in those cases, we try to work with other things to help get them feeling better and get on top of the yeast faster, but sometimes it can be pretty slow. So it really depends. But there are certainly cases that have responded very quickly to treatment. In my experience, children tend to respond quite a bit faster. So I've treated hundreds and hundreds of pediatric patients over the course of time, many of them on the autism spectrum, because I've found in my experience that ballpark 60 to 70% of individuals who are on the autism spectrum, children or adults on the autism spectrum, they will oftentimes have yeast-related issues, as evidenced by either their response to treatment for yeast, or we generally recommend some stool testing to see if there's yeast overgrowth. In the grand scheme of things, stool testing for yeast is pretty inexpensive. As far as private lab tests go, it's about $60 US to do that test, so it's not too bad, even with our not so favorable Canadian exchange rate to the US dollar, unfortunately. And let's see here. Anyway, so in kids, they tend to respond faster as a general rule, but adults can sometimes respond quickly too. So if there are any follow-up questions to this, please feel free to post them in the comment section below. And otherwise, I hope that this was useful.